Hey everybody, my name is Stu Gordon. I'm an orthopedic surgeon. I'm fellowship trained and board certified by the American Board of Orthopedic Surgeons. And a very common question I get, and I see a lot of medical records, that people just don't quite understand what the straight leg raising test is and what it means. So often you see in a lot of medical records, you see SLR stands for straight leg raising positive. What does that mean? Well, to me, that means nothing. In Yiddish, we say it means bupkis. And what that means is that when you do a straight leg raising test, what you're doing is you're irritating purposely the sciatic nerve to see if the nerve is irritated, causing symptoms down the leg. Now, here's the important thing. When you do the study, the person can be seating, or they can be on their back, supine. And you lift the leg up with the ankle straight, knee straight. As you do that, the sciatic nerve stretches out, right? And as it stretches out, if it's irritated for whatever reason, if there's a compression more proximally with the nerve root that's being compressed by a disc or a bone spur, if you have sciatica, the nerve pain goes down the thigh, back of the thigh usually, and the calf into the foot. If it doesn't, that's a negative straight leg raising test. Here's the key thing. When someone says SLR positive, you should ask yourself, what does that mean? Because often the doctor may be talking about radiating pain that's not straight leg raising pain, causing neurogenic complaints. All nerve pain radiates, but not all pain in the leg that shoots down the leg is nerve pain. Let me repeat that. All sciatica nerve pain radiates down the leg, usually in a specific nerve root distribution, L5S1, L4-5, and so forth. But all pain that shoots down the leg is not nerve pain. It could be hamstrings. It could be just musculoskeletal pain, tendons, ligaments, muscle pain, but it's not nerve pain. So you have to ask the question, SLR positive, what does that mean? Is it nerve pain or just musculoskeletal pain? My job as an effective clinician is to figure that out. But you see that commonly in medical records. It means nothing if it's not described. Here's what I do in my records. When I do a sciatica test, I'll examine the patient in both seated or sitting and supine. And what I do is I lift the leg up and ask them what's going on. And they say, my pain is shooting down the thigh, it's going down the posterior calf into the top of the foot. So, oh. And I think to myself, does that correlate with what they told me in history? If they told me in history that they had pain going down the leg, a nerve-type pain, burning, tingling sensation, numbness, and it goes down the thigh, calf, and the top of the foot, and I do this exact maneuver to stress the nerve, they tell me the same thing, that's a match. That's a positive straight leg raising test. So it's very important to correlate and be very specific when you dictate that note. Don't just say straight leg raising test positive. Let's talk about it and see exactly what it is. Detail it. It's very important. Often misunderstood. Thank you very much.